Hi, good morning. Thank you for joining us today. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 1 hour. If there are remaining questions in the queue at that time and you feel your question hasn't already been answered, please put them in the chat or by email and we'll get you a response in writing.
Hello, can you guys hear?
Yes, we can hear you. Can you hear us?
Yes, this is ABC6. I was seeing if we could have access to record.
Sure, I'll go ahead and give you that access to record. Okay, Dr. Vanderhoff, I believe we do have all of the permissions to record granted. So if you would like, we could go ahead and begin, sir.
Terrific, thank you. Well, good morning. I'm Bruce Vanderhoff, the director of the Ohio Department of Health. And today I come to you with some very encouraging developments. First, following the authorization of a COVID-19 vaccine for those ages 5 to 11 last week, we're now able to better protect our youngest school-aged children against COVID-19. And reports from the first days of vaccination have been very positive. I'm also optimistic about new, highly effective products designed to treat COVID-19 on the near horizon from Merck and Pfizer, products which are expected to be considered by the FDA in the days and weeks to come. Recognize, however, that while these oral treatments added to IV monoclonal antibodies offer the promise of yet more tools in our treatment toolbox, they'll be for treating sick people, unlike the vaccines, which are designed to protect you from the beginning, from becoming ill. And that we expect that when these new drugs are first available, supplies will be initially limited and targeted to those who are at the highest clinical risk. So there continues to be real progress in the fight against COVID-19, which should give us genuine optimism. But our optimism needs to be tempered by the fact that the numbers on the ground continue to tell us that we are most certainly not out of the woods yet. Our downward trend has plateaued and now even increased a bit over the last few days. And our COVID-19 cases remain very high. Yesterday, nearly 5,000 cases were reported over the last 21 days. We are averaging about 3,700 cases daily. So think about that. Now, every single county in Ohio is at a high rate of transmission. Without question, the best thing Ohioans can do to prevent the spread of COVID-19 is to choose to be vaccinated. Secondly, those who are eligible to get a booster or additional dose should do so. And finally, all of us need to practice common sense prevention, like wearing masks when appropriate, washing our hands regularly, and practicing cough and sneeze etiquette, especially as we enter the winter months and we enter flu season. Now, I know some vaccinated Ohioans still have questions about vaccine eligibility. So let me offer a brief summary. Everyone who initially received the Johnson & Johnson vaccine should get a booster, but a vaccine of their choice is the booster 2 months after their initial vaccination. So it can be any of the 3 available vaccines for the booster and does not need to be J&J. Now, for those who received either of the mRNA vaccines, those would be Pfizer or Moderna, we recommend that you get an additional dose if you're over the age of 65 or are immunocompromised. In addition, for those 18 and older who originally received either the Moderna or the Pfizer mRNA vaccines, boosters are recommended if they have a high-risk medical condition, or if they live or work in a situation in which there's a high risk of COVID-19 transmission. Now, having said this, booster availability guidelines may be simplified in the near future to include anyone over the age of 16 based on a recent FDA request from Pfizer. In the meanwhile, rest assured that boosters are just that, a follow-up dose that bumps up the protection enjoyed by those who have completed their primary vaccination series, and that those who are vaccinated continue to enjoy high levels of protection against serious COVID illness that can lead to hospitalization and death, especially compared with their counterparts who remain unvaccinated. We are, of course, very pleased with the enthusiasm that we're seeing for vaccination of those 5 to 11, because children most certainly can and do become ill, even seriously ill, and can suffer lasting complications from this virus. And even for those who don't show symptoms, they can carry the virus home to younger siblings or vulnerable adults, continuing the vicious cycle of spreading the virus in families and communities. Now, there may be people who think that their child having a mild case of COVID-19 might be a better alternative to being vaccinated. The problem with taking that chance with your child's health is that there's no way to know if your child will end up with a mild case, need hospitalization, or worse. The COVID-19 vaccines, on the other hand, create a safe, reliable, protective immune response, and are by far the safest way to protect children from severe consequences of COVID-19. Pediatric providers across the country and right here in Ohio are recommending the COVID-19 vaccine for their patients. Nationally, the American Academy of Pediatrics, the American Academy of Family Physicians, and the Children's Hospital Association have all recommended the COVID-19 pediatric vaccine. And last week, I was joined by physicians representing the Ohio chapter of the AAP and the Ohio Children's Hospital Association, who reinforced the message that the COVID-19 vaccine is safe, effective, and a long-awaited way to protect Ohio's children. The pediatric formulation of the Pfizer COVID-19 vaccine is a smaller dose. It's 1/3 the size of what was fully approved and licensed for those ages 16 and older. It was thoroughly tested in young children and was proven to be nearly 91% effective in preventing symptomatic cases of COVID-19 in children. Notably, during the clinical trial, no serious side effects were detected. Much like the adult and adolescent versions, the vaccine is administered in 2 doses, separated 3 weeks apart. Maximum protection comes 2 weeks after the second dose, meaning it can take about 5 weeks for a child to be considered fully vaccinated and best protected from COVID-19. Here in Ohio, I'm happy to report that already more than 34,000 children, 11 and younger, have now started the COVID-19 vaccination process. We're hearing positive stories statewide about the vaccine rollout. And today, I'm joined by 2 experts to share how vaccines are being distributed. First, though, I'd like to share with you this video from the Cincinnati Children's Hospital.
I'm going to tell the nurse that I made it for them because I couldn't live without them.
Are you prepared for this?
Yes.
Okay, are you excited too?
I even practiced with my flu shot.
My goodness, you practice with your flu shot?
Yeah.
Okay.
We've been waiting a long time to get this age group vaccinated, and clearly by your response, you've got lots of other families that are very excited to finally get vaccines. Put your head up and relax as much as you can.
Yep, if you relax your arm, it will not hurt as much. All done.
That was it.
You're done, dude.
You're done.
Good job. I'm gonna go with a Band-Aid. All right, 1, 2, 3. You so rock. I don't even see where I went, princess. Christmas kitty?
That's
there you
cute.
go. Gus, thank you so much for getting vaccinated, buddy.
No problem.
So you just
Barely even hurt.
That's good.
That was really great. Well, now want to turn to some of our experts who are with us today. And first, I'm joined by Madison County Public Health Commissioner Chris Cook. Commissioner Cook, you were able to start administering vaccines last Thursday, November 4th, and have had multiple vaccine clinics. Can you tell me a little bit about how those vaccines are going?
Sure, and good morning to everybody. In anticipation of the vaccine being authorized, we opened registration and appointments for parents several weeks ago so that we would be ready to roll right after the director of the CDC signed off on the authorization. So parents have been making appointments online. We're taking people who are just walking in our doors as well. But we really pride ourselves on our registration process and making it easy as possible for our parents. So we did begin offering that vaccine for ages 5 to 11 last Thursday. The very first child we vaccinated was a 5-year-old. And I remember that was at 9:45 in the morning. And it was a big moment for him and his dad who came with him. And it was a big moment for us at Madison County Public Health. I do remember this young man was wearing a Superman t-shirt, and I think that was on purpose. He definitely felt like Superman and acted like Superman after he got his vaccine. Every clinic that we've had so far has been fun and safe. We only schedule 4 kids every 15 minutes. And for parents who want to wait in their car or outside, we offer them pagers and call them in when it's time for their vaccine. Kids have been really happy, which you don't always see with vaccine appointments. But we've been giving kids little fun things like Slinkies after they get their vaccine. And frankly, I'm a little surprised kids know what Slinkies are these days, but they seem to love them. Parents are happy. A lot of them have been waiting and waiting for this day to arrive. We've had quite a few parents who are eligible for boosters themselves get that done at the same time as their kids. So it's become a bit of a family affair. So we're just a week into vaccinating this age group, but we're already happy with the turnout, and we're looking forward to many more weeks of taking care of these kids. And honestly, Dr. Vanderhoff, it's just exciting for us. It's exciting for our staff. I love to see folks like Nationwide Children's taking care of some of our kiddos here in Madison County. I've been working with one of our local pediatricians who hopefully will start offering vaccine next week. But right now, my health department is the only provider of vaccine for this age group here in Madison County. And if there's one thing that's been made clear to our community during this pandemic, it's that public health will always answer the call. We will always respond to the need. We'll always say yes. And across the state, every local health department here in Ohio still working 7 days a week to do whatever it takes to vaccinate these folks in all parts of our community in a very equitable way. So we really feel it's a privilege to vaccinate these kids.
Thank you, Commissioner Cook. You know, we really do deeply appreciate the work that you and other local health departments are doing, not only with the vaccine effort, but have been doing throughout the pandemic. And in thinking about the role of public health in our communities, I know that your department has strong relationships with the schools in your area, and that your first in-school vaccination clinic was held earlier this week with West Jefferson's local school district. Can you share a little bit with us about how in-school clinics have worked in the past and how you've maybe made some adjustments to address what is a younger audience.
So we started, of course, last Thursday vaccinating, and since then we've done over 200 kids in this age 5 to 11. So we did have our first school-based clinic on Tuesday. We vaccinated 66 kiddos at the Jefferson local schools. We have another school clinic scheduled this Tuesday with our St. Patrick's School in London, and we're finalizing plans for all of our other schools as well. Typically, we hold these school-based clinics right after the school day, since we ask parents, especially for this age group, to be present during vaccination. Most of these schools we've already been in between 4 and 6 times doing clinics for staff and for students age 12 and older. So we do have a lot of experience with our schools, but the adjustment that you mentioned is having the parents present with this age group. It makes them feel a little more comfortable. And we want to continue to make this as accessible to parents as possible. We're holding late clinics every Tuesday and Thursday until 6:30 at our office for the foreseeable future. And we're holding a no appointment clinic tomorrow on Saturday from 9 to noon. And I just, I looking in my background here, you can probably see my way too early Christmas decorations over my shoulder here on my desk. But for me, these decorations are an early reminder that vaccinating these kids now is giving families confidence that their holiday season is going to be as safe as possible and hopefully as normal as possible, because that's what we all really want at the end of the day.
Thank you, Commissioner Cook. As a major vaccinator, you're able to really share a little bit with people about a question that many parents understandably have, and that is questions about side effects from the vaccine. And they've certainly heard from us and many of the health authorities that we've brought here that throughout vaccination, we've reinforced the fact that not everyone even experiences a side effect, but that for those who do, they tend to be mild and short in duration. But what have you heard from parents, and what are you seeing on the ground as you're now vaccinating this younger age group?
We've heard from nearly all of our parents that the side effects are incredibly mild and usually just limited to a sore arm. I, like many of my fellow health commissioners, have watched all of the FDA and CDC meetings when the data surrounding the safety and effectiveness of the vaccine was being considered. And as I've watched these meetings and looked at those results of possible side effects, I've realized how blessed we are to have experts in this country who have made their life's work medicine and vaccines. Locally, we critically look at all of the data as well as the vaccines, and looking at these, I believe they're nothing short of modern medical miracles. Personally, I can tell you I have twin 10-year-olds who got their first dose of vaccine last week, and a little bit of a sore arm is all they had. Now, I will tell you, they tried to tell me that the best remedy for that sore arm is a small ice cream cone, but I think research is still pending on that. But overall, we've heard nothing but good reports from parents about how their kids are doing with the vaccine. Of course, if parents or kids have questions about the vaccine, we take all of the time we need to answer their questions. For example, last Friday, I had a mom and her 2 kids in my office, brought them in. One of the kids had a question about the vaccine and wanted to know exactly what it was doing to help protect his body. And so I sat down and I explained in what I felt like it was a relatable way. I told him, okay, let's say that your teacher tells you there's going to be a really hard 10-question quiz coming up, and she wants the class to do really well on this quiz. So while teaching the lesson, she identifies 9 of the 10 questions that are going to be on the quiz, in essence, giving the kids the answers. But it's still the kid's job to write down those answers and study them. And now the quiz is coming. We don't know when it's going to happen. And we know that the questions might be in random order, but they've got 9 of the 10 answers written down that they can study. So if you study those, you'll do really well on the quiz. You'll get maybe a 90%. And even if you get 1 or 2 wrong, you'll still do really well. And I explained the vaccine works much the same way. It gives your body the answers on how to fight COVID-19 infection ahead of time. COVID-19 is a really hard quiz. And when the virus and the quiz comes, your body will do really well on this quiz and get it 90% right because you've had those answers ahead of time, and the vaccine is going to keep you from getting really sick.
Thank you so much, Commissioner Cook. That is a great analogy, and I think I might borrow it going forward. So thanks for sharing that. Next, I'm joined by Dr. Sarah Bodie, Medical Director of Nationwide Children's Hospital's school-based health and mobile clinics. Dr. Bodie, as a primary care pediatrician, you're very familiar with the importance that vaccines play in childhood health. And those vaccines include not only the COVID shot, but of course, we're also looking right now at flu season and would include the flu shot. We have said that the COVID-19 vaccines can be given at the same time as a child gets a flu shot or other vaccinations. Can you share just a little bit about why the COVID-19 vaccine, alongside of regular immunizations, continues to be so important?
Yeah, thanks, Dr. Vanderhoff. Thank you for having me. This has been really important because routine vaccinations are such a critical part of how we keep kids healthy overall from a multitude of illnesses that affect them. And we've been doing this all along for many decades in pediatrics, safely vaccinating kids to protect them. And we know during the pandemic, even some of those routine vaccination rates dropped. As families struggled with other more pressing either health issues or social issues through the pandemic, they may not have been able to prioritize those appointments, right, to get in and get their child their routine vaccinations. But now children are back in school. They're back in person 5 days a week, learning in school and around each other. And so it's critical that we get everyone caught up on all their vaccines in addition to the COVID vaccine, so that we're not running into a situation where we're actually having now a second type of outbreak. Measles vaccination, for example, is one that we really pay attention to because measles is a highly contagious disease. And kids should get 2 doses of that measles vaccination before they start kindergarten. And so thinking about for our school-aged kids, are they caught up on all those other vaccinations? Sometimes the driver to come to the pediatrician can be if your school lets you know you're behind on vaccines. So as school nurses are working with families to talk to them about all the vaccination, that's a great opportunity to come and see the pediatrician and get caught up on all of those. And then flu vaccine is another thing to talk about and really think about this winter. As we get into these winter months, many of the viruses that we see that cause different illnesses can overlap. So what I mean by that is if you have a child that gets sick, right, with a fever, cough, nasal congestion, sometimes it can be difficult to tell, is this going to turn into something more serious? What is it? Is this influenza? Is it a common cold virus? Is this COVID? And so protecting yourself against all of these more serious illnesses like influenza alongside COVID is really an important part of making sure your child stays healthy this winter. And just as importantly to me, stays in class. Does not have to unnecessarily be out for multiple days in a row while we're determining, what the illness is that's causing them to have symptoms. So it can be a critical part to just keeping your child safe and keeping them in their normal routine this winter with those expectations.
Thank you. So Dr. Bodie, you were there last week at Nationwide Children's as they began vaccinating this younger age group. We saw the video from Cincinnati that gave us a little bit of what that felt like at Cincinnati. Can you share a little bit about what that felt like at Nationwide Children's?
Yeah, well, it was a celebration for sure for us because this is really such a critical turning point to be able to offer this vaccine for this age group. We know that as we were vaccinating older adults and adults in the beginning of this when the vaccine was approved, the kids actually became a higher percentage of the total new COVID cases, right? Because they weren't eligible yet to be vaccinated. And we've continued to see that trend, right? And in that younger and younger age population with our kids being vulnerable to getting COVID disease because they weren't eligible for this vaccine. And to see this come out and to have families who have been anxiously waiting for this for months to come in and really just the joy on their faces to be able to mark this day because they know they're protecting their child. And, kids have been back in school and that's been critical. And we've developed all these great ways with these mitigation strategies to keep them safe while they've been back in learning. But it's been pretty nerve-wracking for many of our parents, right, that have those elementary school-aged children because they weren't able to get them the vaccine to protect them, yet they're sending them to class every day, doing the best they can, of course, to keep them safe while they're there. And school districts have done an amazing job with that. But this now offers what is the best protection these kids have so that they can get back and be enjoying all of these activities that we know they love. The kids at the clinic at Nationwide Children's, just as many of you have mentioned, we've made this an enjoyable experience for them. So talking about superheroes, they are getting a cape, superhero cape, when they're done their vaccine and wearing a superhero sticker there. Kids do well with set expectations. So if their parents are excited about this and calm during the process, so are the kids. We have child life specialists there that do all kinds of great fun distraction techniques so that while they're getting their vaccine, if they're anxious at all, we can help them through that. So it's been a really positive, enjoyable experience. And kids always step up. As parents, we worry a lot about how kids are going to feel and react to things. And they surprise us in a positive way at every turn. We weren't sure kids were going to wear masks when the pandemic first hit. And you know what? They do. Put them on. They're better about it sometimes than adults. And we weren't sure how they were going to feel about this COVID vaccine, but kids are used to getting vaccinations. They know the process. They know what to expect. They know that it protects them. And so again, setting those positive expectations and having them come into clinic, it just goes seamlessly. And that's been our experience so far.
Dr. Moody, of course, a vaccine only is able to protect a child when the child's able to receive it. And I know the team at Nationwide has been very aware of that and working diligently to get vaccines to children. Can you share with us a little bit about some of the distribution strategies that Nationwide has in clinics and in schools?
Absolutely. So equity is incredibly important to us. And so really thinking about what that means as far as access to the COVID vaccine is important. One thing I want to mention is access to the vaccination for us means a couple different things. It means access to a clinic space, whether that's in their school or in a pediatrician's office or a central vaccine clinic that's accessible to a family, both for location and timing and information. But access is also important because it means, to me, access to information that's reputable. So what are we doing to get that education out equitably across communities so parents are able to access good health information as they're making this decision? And then it's also access to healthcare professionals that can answer questions. So being accessible in the community for these families to be able to ask their questions. Some of us may be able to do that. We may know members of our family or communities that are healthcare providers, and it might be easy for us to have these conversations. But we might have some family members or community members that don't have that access. And so what can we do to have trusted professionals and providers that come to them so that they're in a space they're comfortable and can answer those questions? So for deployment, we are offering multiple opportunities for kids and families to get the vaccine, both education and space. We do, of course, have central hospital locations every single day that can do large numbers of children. Those families that can drive down and get there and are anxious to get the vaccine, there's new appointments every day. But we're also employing a school strategy. So we're going to be in most school districts in Franklin County over the next month with our first dose vaccine clinics. Those are going to be offered multiple times. So some during the school day for parents that are comfortable and confident, have gotten the consent and getting their child vaccinated, but may not be able to get off work and get there for those appointments. We're also having evening and weekend hours for parents that are wanting to come with their child to the school clinics to get those done. And then again, as I mentioned, really setting up some forums through the schools to be available to answer those questions. So getting that information to parents, because we want parents to feel confident they've made the right decision when they get their child vaccinated, and we want them to feel good about them. We want them to feel like all these kids I'm seeing in our main office clinic that are getting the capes and feeling like they're making a difference. That's what we want for every family we're seeing. And so it's really important to have those opportunities.
Thank you so much, Dr. Bodie. Well, during the initial rollout of the newly authorized pediatric COVID-19 vaccines, direct shipment of the vaccine was initially only available with a minimum order of 300 doses. Just within the past few days, the federal government reduced that minimum order, and it now stands at 100 doses. But in addition, our state's warehouse is breaking orders down further into 50 dose shipments for providers who need this smaller shipment size. These lower minimums now offer convenient ordering options for providers who are interested in administering the vaccine to the children in this age group, but may have been waiting for these smaller shipment options. Now that Ohioans ages 5 to 11 are in fact eligible for vaccines, about 94% of our state's population is eligible to be protected by the COVID-19 vaccine. As more people are vaccinated, the opportunity for dangerous variants to take hold lessens, and we get closer to putting the serious threat from this virus behind us. Now, before we move on to questions, one final reminder. We've expanded the Ohio Vax to School program. Ohioans between the ages of 5 and 25 who've received at least one dose of the vaccine are eligible to win one of 150 scholarships, or one of at $10,000, or one of 5 $100,000 grand prize scholarships. Now, there are 3 registration deadlines. The first is November 21st, followed by November 28th, and then December 1st. If you register by November 21st, you're eligible for all the drawings. If you register by November 28th, you are eligible for the grand prizes and the drawing selecting 75 $10,000 winners. If you register by December 1st, the last deadline, you're still eligible for the grand prizes. The bottom line is, the sooner you're able to register at www.ohiovaxtoschool with the number 2, ohiovaxtoschool.com, the better. Now I think we're able to shift and take some questions, Alicia.
Thank you, Dr. Vanderhoff. Our first question today is from Laura Hancock with Cleveland.com.
Hi, Dr. Vanderhoff. As you acknowledged earlier today, the cases per 100,000 went up yesterday after 7 weeks of decreases. We're also seeing cases rise in the Mountain West and Northeast of the U.S. Can you talk about what's going on? Do you expect a surge as we head into winter?
Well, I'll tell you what I know and admit that it's all new territory with COVID-19 for everyone who's looking at it. However, we do know a number of things are playing a role here and really underline the importance of us, not counting our chickens before they're hatched. We are approaching a point in this pandemic where I think we'll be able to look at it and think of it as much more of an endemic illness that does not cause serious hospitalization and death at the rates that we've seen over the past 18 months. But we're not there yet. And what is at play? Well, a number of things. I've said from the beginning that the Delta variant of COVID-19 relentlessly was going to seek out anyone who was unprotected, unvaccinated, and put them at real risk for illness. And we're continuing to see that play out. So in some circumstances, what is driving what we're seeing relates to low vaccination rates in some communities. So we have to continue to focus on the importance of vaccination. The second phenomenon is, of course, that the weather has gotten colder, and it has certainly gotten colder in those geographies. And now, of course, we're seeing the weather turn here in Ohio. We've seen that although we've had some beautiful days the last few, we have had a couple of weeks of colder temperatures causing more people to go indoors. And of course, we have heretofore been unable to vaccinate the youngest Ohioans. And that's part of our joy at seeing that all of our school-aged children now will be eligible for vaccination. We know from looking at other parts of the world whose curves are a little ahead of us that whether the youth are vaccinated or not has played a huge role in what their curves look like. So we know that youth can be a major source of continuing transmission of the virus if they are in fact unvaccinated. And lastly, this phenomenon of the Delta wave having somewhat of an M-shaped curve is not new. And I believe we are seeing some element of that as well in what we're facing. So just, I think, a reminder to us that we have the tools, but the work is not yet done in applying those tools in the way that we need to, especially the most important tool, which is vaccination. I'll turn to my colleagues. One is a health commissioner and one is a pediatric expert in this area. So what else would either of you add?
Well, I'll just echo what you said, Dr. Vanderhoff. Kids are a critical part of this. They are members of families and communities, and we have to talk about their vaccination rates and make strategies to help improve that vaccination rate. It's just as important as when we rolled it out with adults. And so really that targeted approach to send that messaging to families and make sure that they're confident and competent in getting the vaccine is really going to make or break partly how this surge goes over those winter months, and particularly for schools. So I'm really encouraged that we did get it in time approved and that we have this opportunity now as Commissioner Cook mentioned, as holidays come and as the winter comes and everyone's indoors, that this is our time. This is our opportunity to really get that vaccination rate up so we can help move the needle.
Commissioner Cook, anything to add before we move on?
I just, again, echoing what both of you said, we've seen those trends across Ohio where we've kind of plateaued and seeing some increase, but like you said, Dr. Vanderhoff, there's work to do still, and it's using all of the tools that we have in concert together that's going to help keep this something that's manageable if we are continuing to rise a little bit. It's using those masks in those very crowded indoor settings, especially for the unvaccinated. It's the vaccination, it's regular testing. I think all of those, when they're used together, can really help.
Thank you all. Our next question comes from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this call. My question is, with the Thanksgiving holiday coming up, we know that families are going to get together. We also know that there are many families where, regardless of the data you give them, regardless of what you say, they will not, certain members of the family will not get COVID vaccines. So what is your advice to the general public about Thanksgiving? Should people go to a Thanksgiving with their family who is not vaccinated? And what should you do there?
Well, thanks for that question. And I think I would echo what I had said before. As we approach not only the Thanksgiving holiday, but a winter holiday season with multiple very important holidays where it's natural for families and friends to want to get together. It's important for the bonds that hold us together, that we have those opportunities to celebrate together. But I'd ask that we do it in a smart way. We know so much more now about this virus and how it spreads. And we have multiple tools at hand to help protect us from getting this terrible virus. The first and foremost one, and I'm going to underline it again, but it's vaccination. If you've not been vaccinated yet, get out and get vaccinated today. Every day matters. And it will have a benefit. Although your full benefit may not be felt for 5 weeks, there's benefit to getting that vaccine started. So number one, let's get vaccinated. Secondly, I've shared that if you're due for a booster, get out and get your booster. And then, of course, we have to apply all the common sense things that we should be applying whenever we think about going out in public. If we're going into a high-risk environment, perhaps one where there are going to be many unvaccinated people, and we're particularly at risk or maybe unvaccinated ourselves, I do think we need to ask, is that really the right thing to do? If we are going to a celebration, think about, is it appropriate to wear a mask? What's the ventilation in that place? If it's a relatively comfortable day, can we open the windows? Can we at least crack the windows to make sure that we're getting good ventilation in the house? Can we limit the size of the crowd this year? I know that in my own family, there have been years where we've literally packed the house with family, and we're not doing that this year, although we will be having a family gathering. It just won't be packed to the gills. We're going to be mindful of the year that this is. So generally speaking, those would be my recommendations. We've all learned a lot. I think Ohioans have become much more not only aware, but confident about how to apply some of those tools as they go forward. Let me pause there and just see if any of my colleagues have anything to add. Okay.
Again, echoing the size of the get together, everyone has who's in their bubble already. So they have those family members and close friends that they've been around before. And so, thinking about that as well. And then Commissioner Cook mentioned we have a lot of tools around testing, around knowing, right? If you're having mild cold symptoms, you need to pay attention to that maybe a little more this year than you did previous years. So heightened vigilance and monitoring and common sense, I would echo that. I think that that's a great strategy for this Thanksgiving.
And the only thing I would add to Dr. Vanderhoff is that we need to be intentional. We don't want to just hope for the best. We need to make active choices to especially protect those that are most vulnerable, the ones that have comorbidities or are at our highest risk. Again, you don't want to exit the holiday season with a family member sick in the hospital or worse. And I think it really comes down to making active choices and not leaving it to chance.
Thank you. Our next question is from Candace Price with WHIO.
Hi, good morning, everyone, and thank you for doing this. I think mostly my questions have been answered, but I just want to address one more time. So we're seeing in our region, COVID numbers continue to go up for the population, and including children specifically. And this is at the same time that more children are eligible to be vaccinated. So do we expect to see, I'm guessing the answer is yes, a change in those numbers as more kids are eligible to be vaccinated?
Well, I'll begin, and then I think maybe I'll turn it to Dr. Bodie. Look, I think that the numbers are reinforcing everything that we've been saying. These vaccines are providing remarkable protection for those who are vaccinated. Even before boosting, they're continuing to protect people very well, especially those less than 65, very well, from ending up in the hospital or worse. We have the opportunity now to protect this population, and because they have not been eligible to receive the vaccine, we have seen their share of our COVID cases increasing. And as I mentioned, there are parts of Western Europe where they are seeing this population, actually a group that's somewhere between 10 and 14, who are actually the major fuelers of their surge. So it's clear that it's really important that we get our youth vaccinated. And I am confident that as more and more of our youth are vaccinated, it's going to be one further very important step in closing the door on this terrible virus. Dr. Bodie, what would you add?
I think the vaccination rate is so key here. So we need to be able to get that access and information out. So enough of these youth ages 5 to 11 do get out and start the vaccination process. We're about to enter into a time where even after school activities move indoors, right? Many of our sporting activities or other extracurriculars are indoors. So this is a critical time. And I do think we can change the narrative and reduce the rate in these kids with vaccination, but that's what it's going to take. So it's going to take everybody focusing on this and being out there to help promote the vaccination right now.
Thank you. Our next question is from Lindsay Mills with WBNS 10 TV.
Hi, good morning. For children about to turn 12, I've heard parents ask, should they wait for the larger dose or should they get their children vaccinated with the smaller dose right away?
Well, I'll open up on that. My answer would be no, don't wait. Many experts, and specifically those who were involved in the clinical trials testing the COVID-19 vaccine for the 5 to 11 age group, have strongly recommended no wait. The studies analyzing children's immune response showed very clearly that an 11-year-old will have the same fabulous protection after receiving the lower pediatric dose, 10 microgram dose, as a 12-year-old would when they get the larger 30 microgram dose. So there's, in my opinion, absolutely no reason to wait. The protection, getting that protection on board as soon as possible is the most important step. Clinically, Dr. Bodie, anything that you would add to that?
No, I think you're exactly right. Do not wait. Go ahead and get that. And even if they're getting the first dose at 11 and the second dose at 12, that's okay. It's okay to change an age in between that time. And you just don't want to wait because, as Dr. Vanderhoff mentioned, like every day counts. You know, we are entering this current surge. And so it would be really more important for the timing to go ahead and get that dose. And kids have remarkable immune systems, and they develop these rapid immune responses and do so well with these vaccines and all the other vaccines we give them. This is highly protective.
Thank you. Our next question is from Laura Bischoff with Gannett, Ohio newspapers.
Good morning. Do you guys have any clearinghouse for information on where all these vaccination clinics are for 5 to 11-year-olds, like when, where, who, including for smaller counties? And are parents required to be there for the shots, or is it just preferred?
So I'm going to open just first with where people can go to get good information. We try to update it as regularly as possible, but one very good source is www.ohio. I'm getting my www wrong.
Coronavirus.ohio.gov.
Yeah, that's right. That's right. Sorry. That's a great source, and we really work very hard to keep that up to date. However, because there can be a little bit of a lag between information being given to us and getting on there. Also think about going to your website for your local children's hospital or health department, because they are going to be very, very strong resources. Many of our pharmacies are also very actively involved. You can check their website. And finally, calling your primary care provider, your family doctor, pediatrician, and asking them because they may have good information or resources. So lots of places you can go. In terms of the mechanics, I have two guests on who actively oversee work in terms of giving vaccines. So I'm going to let them address that.
Well, I would say that no, parents don't always have to be there at the time of the vaccine, but they have to be fully informed and offering consent, of course, right? So we would never give a vaccine to a child without having that, in-depth consent process with the parent to make sure that that's something they completely understand and want. When we offer vaccines at our school-based health centers and our clinics, for example, we do not require parents to be there. They are always welcome, and many come. And if they're really want their child vaccinated at a time they can be there, and that's outside of school hours, then we will accommodate that, again, as I mentioned, with after hours or evening. But we do vaccinations quite a bit during the school day for students, whether their parents are able to be there or not.
So for us in Madison County, this is the first age group that we have asked parents to be there, the 5 to 11. Prior to that, we were doing 12 and older, as long as they had consent and the parents signed off on the vaccination without them being present. We would be happy to do that. We did that at a lot of schools. We did that at some of our drive-throughs as well. But this age group, we've made the decision, feel it's important for the parent to be there. We tend to get a lot more questions from parents in this age group, and we want to be able to provide that answer real time to them. But in any situation, if there is an exception that needs to be made, we're always willing to work with people, but generally we like the parents there for this age group.
Okay, our final question that we have in the queue at this time is from Jake Zuckerman with Ohio Capital Journal.
Hi, everyone. Good morning. Dr. Vanderhoff, if I heard you right, you said about 94% of the state is now vaccine eligible, but about 56% of the state has had a single dose of vaccination. Ohio is the 10th least vaccinated state in the country. I realize that kids were just made eligible, but still 1 in 3 adults are unvaccinated. Do you see Ohio's low vaccination rate as kind of just a reality that we need to deal with? And do you believe that case surges are just part of that reality with such a low vaccination rate? Thanks.
Well, yeah, thanks for that question. Actually, we've been seeing our vaccine, the people showing up for vaccines continuing week by week to go up. And when we look at the information for our state and think about who's been vaccinated, right now for people 5 and up, we're at almost 60% of the eligible people, almost 60% of people 5 plus have been vaccinated. When we look at 12 plus, almost 65%, when I say have been vaccinated, have started the vaccine process, because obviously, as I've shared, this ultimately is a 5-week journey. But 59.64% was the last number I saw for our 5 plus age bracket getting a shot in the arm. When you go and move to 12 plus, that's 65, actually more than 65%. And when you get 18 plus, it's more than 67% have started the process. Actually, I think that those are pretty encouraging figures that really give me hope about where we're headed. Then you just look at the enthusiasm just during the first week of this pediatric vaccination, this 5 to 11-year-old vaccination being made available. And I'm further encouraged by where we are and where we're headed.
To follow up on that, do you think that vaccination rates for COVID-19 are ever going to be on par with Ohio's rates for things like polio, Tdap, flu, et cetera?
Well, as I look at our vaccination rates and compare it to our vaccination rates for flu, I would actually say that we're doing better than we are able to achieve with flu. So we're exceeding the response that we typically see each year on a population-wide basis to influenza vaccination. So that's another encouragement for me. It's hard to make a comparison for our current vaccinations to ones that have been around a long time. So if we look at polio, that's a vaccine that's been around a long time. And B, have been historically linked to some level of requirement or expectation for entering school. But when you look at this is a voluntary effort that we've undertaken, and to have achieved the numbers I just shared, it's actually fairly impressive. And again, causes me to be encouraged about what we're looking at as long as we continue our good effort to get those vaccines in arms. I don't know if my colleagues would like to add anything to that.
I would just echo that continuing effort. You know, we're going to see the enthusiasm for parents these next few weeks that have been anxiously awaiting the approval of this vaccine with 5 to 11. But then as that surge gets met and dies down, that's in my mind where the real work begins around continued education and access, and to make sure that we're still doing that with the 12 and up age group for pediatrics as well. And every week we're getting, families come in and have that conversation and choose to get the vaccine. So this is going to be a marathon with continuing that education and doing this week after week.
Dr. Bodie's right. I think in the beginning, what we saw in the beginning of this year, we saw more mass vaccination efforts, right? So we didn't have to do a lot of strategic planning about hitting this community at the beginning, because the people came when they were eligible and we had the vaccine. But as both doctors have referred to, this is the more strategic surgical inserts into the community to find those places that are under vaccinated. I think it is possible to answer, the original question. I think we can get there, but it's going to take very, very specific efforts in looking at things a little bit differently. You've seen evidence of that over the last year, offering, incentives and gift cards and Vax to School. Those tools are progressing in those numbers and helping us. So I think it's just being open to a lot of different things to reach these populations.
Thank you, Dr. Vanderhoff. That was our final question for the day. If you'd like to share any final closing remarks.
Just want to express thanks again to my guests who joined today for offering their experience and expertise from the field, and my gratitude to the press for joining us to talk more about this very, very important topic. Thank you.